Welcome back guys. Now let's continue with the topic of gastrointestinal motility. The contractions of your GIT, is it under your control? Tell me. No, it's definitely not under your control. You can't contract your stomach or you can't contract your intestines, right? So then who is the pacemaker? The pacemaker of the GIT is interstitial cell of Kajal. Okay. So the interstitial cell of Kajal is the pacemaker of the GIT. The contractions are regulated by this cell. Who is the pacemaker of the heart? The heart is under the control of the SA node, and the respiration is not under our control, right? So respiration is also having a pacemaker, that is the pre-Botzinger complex in the medulla. In the same way, the contractions of our GIT is also not under our control. So it is regulated by pacemaker cell called as the interstitial cell of Kajal. In your pathology, a very important question is there: if you are having a tumor of this interstitial cell of Kajal, if you are having tumor to this interstitial cell of Kajal, they are called as gastrointestinal stromal tumors. So you have to remember, gastrointestinal stromal tumors are arising from which cell? Interstitial cell of Kajal. Next, how many pacemakers do you have in the heart? There is only one pacemaker, SA node. And how many pacemakers are there for the respiration? Only one, that is the pre-Botzinger complex. But for the intestines or for the gastrointestinal system, there are many interstitial cells of Kajal. So always remember, there are many interstitial cells of Kajal, not one, many. From where they are starting? See, these interstitial cells of Kajal, they are starting from the body region of the stomach. So they are not present in the esophagus. They are starting from the stomach, and that too from the body region of the stomach, from the greater curvature area. And from there, they are going up till to the rectum. So from the stomach up till to the rectum, these interstitial cells of Kajal are there. Throughout the GIT, they are there. Now you need to understand, in between the smooth muscles, gastrointestinal smooth muscle, one cell is connected with the other cell with the help of these gap junctions. So gap junctions, where they are present? The gap junctions are present in the smooth muscles of the GIT. Okay. Now how they are going to help us, later we will discuss. Let's see what exactly is this BER, basal electrical rhythm. Guys, try to understand. Okay. Let's say this is the interstitial cell of Kajal. Okay, this is the interstitial cell of Kajal. We all know every cell is having a resting membrane potential, usually negative. Now these interstitial cells of Kajal, they are also having some resting membrane potential. Let's say some negative value is there. But this value, this voltage is not going to be constant. It's kept on fluctuating because of the influx of ions and efflux of ions. Because of the ion movement, the voltage in this interstitial cells of Kajal is kept on fluctuating, increasing, decreasing, becoming positive, again negative, becoming positive, again negative. So there is this voltage fluctuations happening continuously 24/7. So these voltage fluctuations, they are called as basal electrical rhythm. Okay, basal electrical rhythm, also called as slow waves. So this question was asked, slow waves are seen in, the slow waves of the basal electrical rhythm is seen in interstitial cells of Kajal. Okay, done. Next, whenever there is parasympathetic stimulation, the parasympathetic nervous system, that is vagus. We all know when the vagus is activated, what vagus will release? Vagus is going to release acetylcholine. Whenever acetylcholine is acting on this interstitial cells of Kajal, okay, whenever the stimulation is coming, now do you know what this interstitial cells of Kajal going to do? Now they are going to produce a more electrical fluctuation. Now there is more voltage fluctuation. Okay, so there is a bit more voltage fluctuation seen. So these spikes which are coming over here, okay, these spikes which are coming over here, they are the real action potentials. Okay, so number one point, these are called as spike potentials. They are called as spike potentials. These are real action potentials. This basal electrical rhythm, try to understand this basal electrical rhythm, they are not depolarization, repolarization. Don't think that this is a depolarization, repolarization. They are just local potential, local voltage changes. That's it. But here, these are depolarizations and repolarizations. So spike potentials are the action potentials. So they can lead to GIT contractions. Okay, they can lead to GIT contractions. But tell me, during basal electrical rhythm, will there be any mechanical contractions? Will there be any GIT contractions? No, no contractions. Okay, no contractions. They are just a simple voltage fluctuations. Okay. Now, whenever the sympathetic nervous system is activated, let's say, now in this fellow, the sympathetic nervous system is activated. Sympathetic neurons are activated. What the sympathetic neurons will release? Epinephrine or epinephrine? Whenever epinephrine is acting on the cells, tell me, whenever you are sympathetically active, that's the time where you have to either fight or fly away. You have to either fight or you have to run away. Is that a good time to have the GIT contractions? Is that the good time to give the energy for the contraction of the muscles? No, definitely not. That's not the time to digest, right? That's not the time to move the foot. So what I'm saying, whenever you are sympathetically active, okay, that sympathetic nervous system will try to inhibit the GIT. We all know sympathetic nervous system activates the heart, but it's going to inhibit the GIT. So right, whenever you are sympathetically active, the epinephrine, when it acts on this interstitial cell of Kajal, what will happen? Now, look what is happening to the spike potentials. The spike potentials are decreased and you are going back to the normal basal electrical rhythm. So, who is responsible for the spike potential? It's the parasympathetic nervous system responsible for the spike potentials and going to cause the GIT contractions. But when the sympathetic nervous system, what it will do? It is going to inhibit, it's going to decrease the spike potentials, it decreases the GIT contractions. Okay. Now, we all know, see, this is the depolarization. These spikes which I am showing, okay, these are the depolarization, repolarizations. When a cell is depolarized, let's say this interstitial cell of Kajal is getting depolarized. Now this depolarization with the help of gap junctions is going to go to the surrounding muscles. See, when the cell becomes electrically positive, depolarization means what? The cell is becoming electrically positive. Okay, there is a lot of positive charge in the cell. Now these depolarization, these positive charges, what they will do? From one cell, they will go to the other cell through the gap junctions. It's just like, try to understand. Imagine a group of people, they are connected with one another. Okay, they are all holding the hands. If one person gets electrocuted, okay, if one person gets this electrical shock, okay, now that current is going to spread through all of them are going to have this shock. In the same way, here, once this interstitial cell of Kajal, once it is getting depolarized, that depolarization with the help of gap junctions will spread to the surrounding muscles and from one muscle to the other muscle with the help of the gap junctions. So muscles, once they are getting depolarized, the smooth muscles, once they are getting depolarized, they will contract. Okay. So this is how electricity flows. Done. Now, what and all we have discussed here, let me show you the same thing in a graph. You already know this. See, here first I am talking about the electrical recording. First electrical recording. Later I will be discussing about the mechanical recording. Mechanical means contraction. Electrical means voltage fluctuations. Guys, look, in the beginning, let's say in the beginning, so there is this quite electrical fluctuation happening. Okay, these electrical fluctuations are happening 24/7. And what are they called as? They are called as a basal electrical rhythm, you know, basal electrical rhythm voltage fluctuation. During this basal electrical rhythm, is there any mechanical recording happening? Any mechanical recording? No, it's like a flat line, no mechanical contractions. But whenever there is parasympathetic dominance, that is acetylcholine available, see, you can see this spikes. These are the spike potentials. Whenever the spike potentials are coming, what is happening to the mechanical recording? See, now the GIT is contracting. Now contractions are happening. But whenever there is a sympathetic activity, that is epinephrine, what is happening to the spike potentials? Decreasing. Whenever spike potential decreases, that's a depolarization, action potential decreases. So what is happening to the mechanical contractions? Also decreasing. So done. With this, the concept of the basal electrical rhythm completed. Okay. Only one thing, basal electrical rhythm, also called as the slow waves, which are seen in the interstitial cell of Kajal. They are just the voltage fluctuations. They are not action potential. They do not contribute to any contractions. Done. Next, my question to you is, do you have one interstitial cell of Kajal or many interstitial cells of Kajal? We are having many interstitial cells of Kajal. So there are interstitial cell of Kajal present in the duodenum. Yes. Interstitial cell of Kajal present in the stomach. Interstitial cell of Kajal present in the cecum. Okay, these are all the different interstitial cell of Kajal. Now, in the interstitial cell of Kajal, we are having the basal electrical rhythm, yes or no? Every minute the voltage is fluctuating. Look at here, in the duodenum, the voltage is fluctuating more number of times or less number of times. What do you think? How many times the voltage is fluctuating? More number of times. How many times? 12 times per minute. 12 times per minute. So, the basal electrical rhythm is 12 times per minute in the duodenal interstitial cell of Kajal. But what about the cecum? How many times it is fluctuating? It's only 2 times. 2 times per minute. And one of the exam they have asked about the stomach also. Okay, how many times? It's a 3 times per minute. Okay, so these are the 3 important things which I want you to know. Guys, now tell me, where do you see the maximum basal electrical rhythm? Maximum rate of basal electrical rhythm is seen in the duodenal interstitial cell of Kajal. Minimum where? Minimum in the cecal interstitial cell of Kajal. But if they ask about the stomach, it is 3 times per minute. Done. So rate of B are also completed. Next step, let's see what is the difference between the type of contractions, that is the peristalsis versus segmentation. How the question is going to come up in your exams? The question will be image based question. Okay, question is going to be the image based question, guys. Now, students, look here. Here is the food bolus. Let's say you have taken some food and here is the food. Now, what is the purpose of peristalsis? First, we are going to discuss about the peristalsis. What exactly is peristalsis? Peristalsis means the movement of the food. We always want the food to move from the mouth to the esophagus, to the stomach, to the intestines, to the rectum, something like that. We always want the food to be going in one direction. Always ab-oral means away from the mouth, ab-oral. Do you want regurgitation? No, we don't want any regurgitation. So, food should be always moving forward and there shouldn't be any regurgitation back. So, that's why we are contracting this proximal segment. So, this proximal segment, it is getting contracted to prevent regurgitation. And what will happen to this distal segment? It is undergoing relaxation to welcome the food. Okay. So, such type of GIT contraction where a proximal segment is undergoing contraction and a distal segment is undergoing relaxation. So, there will be anterograde movement of the food, anterograde movement of the food. So, you can clearly see the food bolus is moving forward, forward, forward. Okay. So, such type of GIT contraction is called as peristalsis. Now, how the question is going to show up in your exam? One is image based question. So, whenever you are seeing a forward going arrow, the food bolus going forward, it's a peristalsis, guys. Next, what is the other way that you can expect a question is, see the proximal segment is getting contracted, right? This area is getting contracted. Now, what are the neurotransmitters responsible for this contraction? And what are the neurotransmitters responsible for this relaxation? The proximal segment contraction, distal segment relaxation. So, the contraction is due to which neurotransmitters? Like acetylcholine and substance P. Acetylcholine and substance P, they will cause the contraction of the proximal segment, and here the relaxation. The relaxation is because of nitric oxide and vasoactive intestinal peptide. So, nitric oxide is going to cause a relaxation, VIP causes a relaxation, but ACH and substance P causes contraction. Done? Next up, what about the segmentation? In segmentation, see, the food is gradually getting digested. Okay, the most important thing is the food getting digested away. It's not the movement of the food, it's the digestion of the food. So, these are a kind of mixing movements. Okay, segmentation is a mixing movement. Mixing movements. So, what exactly is happening here in the segmentation? The food is going to be mixed with the enzymes. Okay, you can see here the proximal segment and the distal segment both are contracting. Both will contract. Now, the food is divided into small boluses. Here, the food will be mixing with the enzymes. The food will be mixed with the enzymes. Okay. So, segmentation is mainly for the digestion. See, I am not showing any forward going arrow. The important thing is the food is getting digested into small particles. So, peristalsis is for the movement. Segmentation is for the digestion. So, right, peristalsis is for the movement and segmentation is especially for the digestion. So, the keyword they will use if they ask about the mixing movement, which are the following are the mixing movements? Segmentation. Segmentation is a mixing movement. Okay, done. Next, then my question to you. First of all, students, tell me here, this peristalsis and segmentation, are they happening during fed state or fasting state? Tell me, are they seen when a person is fed? Are these movements, these contractions, are they seen when the person is fasting? You can very clearly say, sir, here there is food, there is food. So, definitely this peristalsis and segmentatory movements, these are seen during fed state. They are seen during fed state. My question to you, if a person is doing fasting, let's say, he is doing fasting. During fasting condition, do you think will his GIT contract? Yes, answer is yes. Okay, even during the fasting states, the GIT will undergo contractions. So, those contractions are called as migratory motor complexes. Migratory motor complexes. In short, we can call it as a MMC. MMC, migratory motor complex. Remember the word M. M is important. Migratory motor complex. Now, first point is they are seen during fasting states. Okay. The contractions will go from stomach to the colon. These contractions are going from the stomach to the colon up till to the rectum actually. Now, why? Even during the fasting state, the GIT is contracting. Why? To clean the GIT. If there is any leftover material, any plaque, something. So, it's for the cleaning purpose. So, the migratory motor complex is going to clean the GIT. That's why it is called as a broomstick of the GIT, housekeeper of the GIT or sweeper of the GIT. These contractions can sometimes cause hunger pangs. Okay, fasting, right? So, the person can feel this. Okay, so hunger pangs. Now, what is the important thing? It is going to prepare our GIT, cleaning the GIT, preparing the GIT for the next meal, making sure that GIT is clean and good so that we can have the next meal. Now, how frequently we get these migratory motor complexes? See, these migratory motor complexes, one migratory motor complex is seen in every 90 minutes, means whenever you are doing fasting. For example, from morning you are not eating anything, you are doing fasting. So, during this fasting condition also, for every 90 minutes, that is for every 1.5 hour, there will be migratory motor complex cleaning your GIT. This is the frequency. One migratory motor complex is seen in every 90 minutes. And this migratory motor complex is mediated by a hormone called as a motilin. I have already explained everything about the motilin. Okay, motilin produced from the Mo cells. Okay, the motilin receptor is stimulated by a drug called as erythromycin. Erythromycin can be used in the treatment of diabetic gastric paralysis, paralytic ileus. Okay, remember that. So tell me, this migratory motor complex, M for M, migratory motor complex, motilin mediated, once in every 90 minutes. So with this, we have completed migratory motor complex also. So you can see the motility in the GIT. Okay, the real mechanical motility. During fed state, there can be peristalsis and segmentation. Peristalsis for movement, segmentation for the digestion. Both will happen simultaneously. And during fasting condition, what do we have? Migratory motor complexes. Okay. And what is electrical motility? Electrical motility means electrical fluctuations that is happening in the interstitial cell of Kajal, that is called as a basal electrical rhythm. Are they action potentials? No. Action potentials only seen during the parasympathetic activity or whenever there is acetylcholine available. That's going to be spike potentials or action potentials, you can say. So with this, I can conclude the topic of gastrointestinal motility. Hope the video is helpful. Thank you.